how do you know if it's a mental health issue or if it's just maybe a way a person is wired or that's their character? But how do you know, like how do you know when someone needs to be seen for a mental health issue?
Mm-hmm. So that's kind of a difficult question because a person can be wired in a way and it's a mental health issue. So like a narcissist, they're wired in a certain way, but it's still a mental health issue.
Interesting.
Right? A lot of times you'll see it in the behaviors, but the major thing is you'll see it in relationships, and you feel mental health in your body first. It always happens in the body phase. So if you're anxious, if you're depressed, you start feeling down, you start feeling like you look at your behavior, you start isolating. The biggest thing to determine whether it's a mental health issues is to see the changes, to look at the changes in behavior. So if you have a person that was once gregarious and happy and involved, and now they're not coming to church as much, and you're inviting them out, and they're like, no, I'm good. That's how you know that you need to check on that person because something is right. Something is not right. It's the major thing is behavior change. You always have to look at the behavior. And that's important, especially with kids, because their behavior looks different. They may start acting out. Smaller kids may say, my stomach hurts or I got a headache. They're always sick. They don't feel good. Where you have teenagers that may start acting out, wanting to do what they want to do. You can't tell them nothing. Or they may just not feel good. They may not want to hang out with their friends as much. They may not want the things that used to make them happy no longer makes them happy. Always look at the behavior. That is the telltale sign that something is off.
Well, how do you know with that in mind when it's just, we need to talk through some things, counseling, coaching wise, or this is clinical and you need medication?
I think you have to start with the counseling coaching. You have to start with hey babe, I noticed, blah, 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 blah. When they start saying, I don't know, I don't know, I just don't feel right, that's clinical. When they can tell you, well, I was hanging out with my best friend. She said something smart to me, and it just kind of put me in the mood. That's something you can work out at home.
Gotcha.
But when they can't verbalize it and they don't have the vocabulary for it, then you might want to take them to therapy. Because one thing therapists will do is give them the vocabulary.
Got you.